There you go. 3 minutes for you guys to prepare. Live with the timer. What are you going to do in 3 minutes? Three things that I always tell you. You have to decide. First of all, you have to decide whether the patient is known or none, or known or unknown. So obviously, the patient is admitted in the hospital. You can consider the patient known, right? You can begin with a certain name. You do not have to go, how may I address you, and blah blah. Then, of course, what are you going to use? What statement are you going to use to establish trust with your patient? After that, you go to the core part, core that I call that's related to medicine. So you're going to explain the patient the ongoing issues in a simplest form. After that, you're just going to recommend and do the reassurance a little bit. I'll give you 3 minutes. Prepare this. Please write it always, whatever you have to tell. There are a few things that I'll type on the screen. Um, Please check it out. Well, when you speak, it is better to include this into the conversation. They call idiomatic phrase in terms of, in terms of, then deal with, sort of, kind of. In fact, it's better to include these. Not all of them, of course, but two or three of them in 5 minutes. It's going to put better impression. Make sure it's very easy to use it if you are willing to go through. Then add all spacing, of course, as well as look for. Just think and it'll happen. Not a rocket science. Pretty easy. All right, now we can begin. Let's see how you guys do. Okay, let's see. Geeta, you can start.
Okay, sir.
All right.
Okay. Hi, it's me, Gitali, one of the registered nurses of this hospital. Today, I'm your attending nurse. Okay, Mr. John, how are you feeling today?
Um, I don't feel very good. I'm not able to swallow, speak, and breathe properly. Was my surgery successful?
Oh, yeah, all right. I can understand your situation, Mr. June. You had undergone a thyroid gland surgery remover, which is successful already. Are you aware of it or not?
Yeah, I know that I had surgery, but why am I feeling this way? I cannot speak, like I said. I cannot swallow and I can't even breathe. So maybe the surgery was not successful?
No, no, Mr. Jung, it's already your surgery is successfully done. It's a common problems. Every patients of this okay, surgical procedure will experience these kinds of problems. So don't worry. Let me inform you. Let me clear your all concerns. So. Um, uh, as you know, the thyroid gland is located near to the throat. So during the surgery, there is there we done a small incision. So uh, um, during that time, the muscles and tissue are little bit weak and damaged there. So that's the main reason why you fail, why you feel pain during swallowing. Are you getting me?
Okay, I get that. So when will I feel better?
Uh, Don't worry, Mr. John. It will subside. It will be go away after 2 to 3 weeks, and you will feel better. So don't worry about it. So, can I ask you some more questions,
Yeah, sure.
Mr. What did you had in this morning?
I ate a little bit of soup, that's it.
Oh, that's good for your recovery. So I suggest you that don't eat um, raw food. It will affect your recovery. Uh, it will affect your. It will affect.
It will affect.
It will affect. And you said you had problems in speaking, right?
Yes, yes, of course. I feel pain when I speak, and then, of course, even when I swallow, I feel pain, and also while breathing, I feel pain.
So, Mr. Jun, um, I would like to suggest you that don't speak continuously, and you should not pressurize your vocal cord. It may affect in your recovery. So, I would like to request you that if you want to say anything or if you want to convey any information, so you can. I can provide you some pen and paper so you can write there. Is it okay to you?
Uh, okay, it makes sense. Sure.
Okay, let me add one more thing. So, if you find any difficulty during breathing, I can suggest you to elevate your head by having extra pillow at your back, even while you are sleeping. So, make sure don't lie in a straight position. It may difficult you in breathing. Are you getting me?
Okay, I get that. All right. So how long do I have to stay here in the hospital?
Uh, it takes 2 to 3 weeks. After that, you may go home, Mr. Jun.
Okay, I get that. All right. Thank you for sharing the information, sister.
Is there any other problem you want to share with me, Mr. John?
No, no, I don't have any other problem.
Okay, thank you for. Sorry. Okay, let me conclude it at last. That why I what I told you before that if you find difficulty in speaking, so during that time don't speak too much. You can convey informations or any message by writing. And if you find difficulty in breathing, then you can use extra pillow to elevate your head. And for swallowing, it takes a few days to recover. To recover, are you getting me?
Okay, I understand.
Hope I am able to clear all your doubt. So if you want any help from my side, you can call me. I am always there for you.
Okay, I get that.
Thank you for your time.
Exactly finished in 5 minutes. I mean, if there is anything needed from my sides, I mean, there are so many grammatical errors in your conversation, so many. Using wrong grammar at multiple places. Another thing that I notice is that you have a very strained voice. You're nervous, and I can, by listening to you speaking, I can already feel that you're very nervous. Now, okay, intro. Okay, not bad. Intro. No problem with the intro. Could be better, definitely. But the core part, idea was there. I mean, where you were mentioning, it's normal to feel like this and like that. You were actually generalizing, and you actually talk to the patient about whatever is going on at the moment. You're trying to make it relevant, but the language is not supporting in the middle part. The intentions were good. Sorry, the intention was good, but still didn't come properly. It doesn't look like a very well-rounded speaking. We'll talk about it. Let Namrata also finish. Ready?
Yes, sir.
Go.
Good morning, Mr. Zone. I am Namrata and I am your head nurse for today. And how are you feeling now?
Nothing special, but of course, I have to tell you that I feel difficulty while speaking and swallowing, and even while breathing,
Mm-hmm.
I feel there is something in the neck
Mm-hmm.
area. I don't feel very
Okay.
comfortable.
So you have undergone for surgery called as thyroid gland removal, and it went well with no complications. And the concern that you say to me now are common symptoms that we usually see after this surgery, like having difficulty in breathing or difficulty in swallowing and speaking. Because since the surgery you underwent, usually it happens around the neck side. Thyroid glands is located in neck area, so that's what making you difficulty in swallowing, breathing, and speaking. But
Oh,
not to worry, it will go by 2 or 3 weeks. Is it fine?
yeah, yeah, of course, definitely. Thank you for sharing that information. So, what about the pain and everything else? How long do you think it's going to take for me to get
Yeah,
better?
it will go by. Yeah, it will go by 2 or 3 weeks. It will take for the recovery nearly by 2 or 3 weeks. You'll be getting fine. And what I suggest to you for the meantime is do not pressurize your vocal cord or do not speak for prolonged time. It may again pressure your vocal cord and lead to more pain. So take a rest and do not pressurize more while speaking. Does that help?
Okay, okay, sure. I will make
Mhm.
sure that I don't do that.
Okay, so I would also request or suggest you to elevate your bed while you are sleeping, because it also helps in aspiration prevention, because since there is surgery on your neck side, it may you will have you had swallowing difficulty, so which also may lead to choking. That's why I would suggest you to elevate a bit while sleeping for first 4 to 5 days. Will that be okay with you, Mr. Zone?
Okay.
Okay. So you have undergone surgery, thyroid gland removal, which which may have common symptoms like swallowing difficulty, difficulty in speaking, and difficulty in breathing. So these all are quite common symptoms that everyone have. So don't get panic and don't get worried about it. It will go by the time of 2 or 3 weeks. And we are here, our team are here to support you
Mm-hmm.
and to take care of you throughout your stay in hospital. And I would strongly request you or strongly suggest to you not to pressurize your vocal cord and to elevate a bit while sleeping as well for 4 or 5 days.
Mm-hmm.
Does that sound helpful to you, Mr. John?
Yes, it does sound good.
Mm-hmm. Okay. So if there's anything that you uh, uh, need help from us, we are always here to help you. You can give us a ring bell. We will be here to attend you.
Mm-hmm. Okay. Still have 50 seconds left.
50.
Yeah, still have a lot of time.
Okay, so is there any other thing that is bothering you, or do you have any concerns that I can help you with?
No, no, I don't have any questions at the moment.
Hmm. Okay, so please be assured that we are here to help you, and it's been many years. Let's say, like since 5 years, I'm working here in this hospital, looking after the post-operative patient and post-operative care. I'm
Stop.
involved in post.
See, I'll tell you the problems, both of you. Actually, it's a very common problem among OET aspirants. Mm, It became monologue. I mean, it should be avoided, the first thing. You should always involve the patient into the conversation. Try to ask as many questions as possible. Then, um, I mean, the simplicity. I mean, how would a nurse react if it actually happened? If it's actually happening in a clinical setting. I mean, obviously, whatever given there, the task that you have there, it's not enough to make you last for 5 minutes. There has to be things that needs to be added there to make it last for 5 minutes, right? So, of course, very good points that you use. That since thyroid gland is around neck area, and since you've been operated in that area, in that particular area, in given area, windpipe, food pipe, and everything passes through that zone. Therefore, you're having a little bit of difficulty. Now, that was a very good point. Now, what I'm trying to tell here is, first of all, it became a monologue. You don't show that you're attentive. It is also needed. When the patient is saying that, was my surgery successful? I think I'm having some problem with speaking. I have some difficulty swallowing. I can't even breathe. At least try to show the assessors that you're actually listening or being attentive or paying attention to whatever the patient is saying. Like, okay, I get that. All right. Mm-hmm. Oh, swallowing. Really? Breathing. Okay. Also breathing? Okay. Something like that. When you're talking, you need to react from one side. That shows that you're trying to be attentive. Like actually, this is also part of relationship building. So from the beginning itself, you can simply start, hello, John, how are you doing? You look slightly apprehensive, a little nervous. You tell me in your own words what's bothering you. And then the patient says, okay, before concluding anything, let me examine your wound. Okay, I've just examined your wound. And by looking at your wound, it is completely healthy. There's nothing wrong with surgery or successful. Are you getting me? The patient says, I have difficulty with speaking, swallowing, and breathing. Okay, I understand your concern. It must be very hard for you to be in this situation. Um, so let me tell you that at the operation site, after surgery, after thyroid surgery, it is very common among patients to feel this way, to feel difficulty with speaking, swallowing, and breathing. But you're not an exception. So what I actually would like to suggest to you at this point of time is to rest as much as possible. Do not put any strain on the throat, and you'll be fine. So let me give you a detailed explanation of this. Are you willing to listen? Are you willing to hear? So since you've been operated in that area, so whatever the Namrata said, you can use that, right? So give suggestions. The less you put pressure in that part of the body, the faster you will recover. Do not try to pressurize the vocal cord. Don't try to yell. Don't try to speak in louder voice. Don't actually, as a matter of fact, I would suggest you not speak that much. Whenever needed, you can speak. I can provide you pen and paper. You can hit the buzzer. You can ring the bell so that we can come and address your needs. It is not very important for you to speak at this point of time. So don't speak too much. This will reduce the stress or strain on the throat. All right. Then I would also suggest you to keep your head elevated. There are many ways it can be done. I can instruct you. I can actually tell the other nurse also to do it, or simply it can be elevated. I can put pillow, or the bed itself can be elevated, pushing a button. So I have given you the remote. If you really need to elevate your head part, you can press this button and you can do that. Be more real, like how it happens in a clinical setting, instead of speaking as if you've learned and memorized certain sentence structures or sentences, and you're just blurting it out in front of the interlocutor. So this is what I feel in your conversation. There's no practicality. It doesn't feel that I don't feel that you are talking real. You have just you have just few notions, few ideas, which you are just speaking it out very often, just regularly speaking and speaking and speaking, not listening to the patient. And attention from your side is also not there, right? So it has to be real. Towards the end, I know you're a bit worried. I've already examined your wound. There's nothing to be worried about, trust me. Um, in my experience, in 2 to 3 days, the patients already feel better. And I'm sure that you're also going to feel better. For now, just follow my advice, especially don't do anything that will put pressure on the focal point and try to rest as much as possible. Your recovery will then be optimal. Yeah. So you can use in terms of your wound. Yeah. Then I know that it was very hard for you to deal with this situation, something like that. You can try to incorporate these things also into the conversation if you can. It, natives usually use many of these phrases, and you should also think about including some of them into the conversation. So what I want to tell you, number one, don't make it a monologue. Number two, make it real and professional. That's it. Otherwise, it's okay. Of course, there are grammatical errors as well, in many places, which actually fixes. It gets better with time once you have the awareness. That's why I would like to suggest you that whenever you practice at home by yourself, record yourself on the phone, take a piece of paper and listen to your own recording, your voice, and try to write down whatever mistakes you're making so that you are aware. Self awareness is very important to develop, to progress. So the only thing that is lacking at the point is practice, I think. But some of you, I mean, you used very good points, and I'm very happy about it. All right. Okay, not bad. Continue with the next writing, and we'll catch up tomorrow morning, same time.
Okay, sir.